Hi, I'm Bob Sanborn. I'm President and CEO of Children at Risk. What we know about mental health is that probably 1 in 5 children in America have a mental health problem of some sort. But what we really know, statistics and research show that here in Houston, 50% of all the children in our juvenile justice system indeed have a serious mental health problem. So that means when we start talking about mental health and its ties to juvenile justice, there's a lot of work to be done.
Mental health issues have really become a problem for our children. And the outcome of this is that we're seeing that children are receiving their mental health needs in the juvenile justice system. So we have to ask ourselves, what does this mean? What this means is that children are having a harder time at home, they're having a harder time in school, and basically are being put into the juvenile justice system where their needs are minimally met.
The Harris County Jail has become the largest mental health facility in the state of Texas, one of the largest in the nation. One of our best advocates for expanded mental health services throughout the community is the Director of Juvenile Justice, Mr. Harvey Hetzel, because he sees the substantial number of children who have been placed in his custody, not because of the severity of the crime, but because the judges are trying to get help for the kid and protect society.
Research shows that it's much more cost effective for these mental health needs to be met in the community. Very beneficial to children, society, and especially taxpayers. So the reality is that it costs $170 a day on average to meet the mental health needs of our children in the community versus over $250 a day in the Texas Youth Commission in our juvenile justice system.
I believe we really need to flesh out a system of services where young people are identified early, where they have access to appropriate services, where we wrap services and supports around the young person and their family.
I think if you can take care of those mental health issues and have people successfully complete juvenile probation, you have the potential to transform the whole community by keeping these youth from becoming adult criminals, and could save a lot of victims a lot of money, a lot of heartache. You can punish, you can send folks to institutions, and you can not deal with the underlying issue, but they become involved in crime again and recidivate. You can actually help control crime, future crime, by addressing the underlying causes and try to use the community-based programs and treatment.
Getting a 10? Yeah.
Is there a quick fix? No, it's not a quick fix. But does it look like we're starting to turn the ship? Yeah, I think we are. Our folks are really looking hard and saying, is this cost effective, what we've been doing? And I think the answer they've been coming up with is no. And so let's look at really building a better mousetrap for these young people and having the kind of positive outcomes that I think everybody wants to see for society.
For more information on these issues, please visit us at our website at childrenatrisk.org.